Hello everyone, good evening. I am Dr. Pranitha Reshmi. Welcome to today's Facebook live session. So today we are going to discuss a very interesting question that almost every IVF couple asks me. Doctor, I conceived through IVF. Can I still have a normal delivery? So before I answer, let me know in the comments how many of you think that IVF always means the cesarean section. So I see many patients who come to me with this fear. They say, Doctor, we struggled for years, underwent IVF treatment and finally conceived. We are scared to take any risks. So is the normal delivery safe? First, let me assure you that IVF is simply a method to achieve the pregnancy. It does not determine how the baby will be delivered. So many women who conceive naturally uh, require a cesarean section, while many women does not require any cesarean section. They may have the normal delivery. So the method of conception and the method of delivery are two different things. Now, what actually determines whether a normal delivery is possible? Let us discuss. The first factor is the baby's position. Ideally, the baby should be in the head down position near top. If the baby is breech or lying sideways, then the cesarean section may be needed. And the second factor is the number of babies. If you are carrying twins or triplets, then the chances of cesarean delivery may be higher. However, some twin pregnancy can still be delivered normally under proper supervision. And the third factor is the mother's health. If you have any blood pressure, gestational diabetes or thyroid problems or heart disease, then it influences the mode of delivery. So let me ask all the mothers who are watching live, did any of you have these medical related problems in your pregnancy? So another important factor is maternal age. Many IVF patients are in their late 30s or 40s. So age itself is not a contraindication for the normal delivery. But older mothers may have more pregnancy related complications that require closer monitoring. So one common myth I hear is, Doctor, IVF babies are very delicate, so labor pains may harm the baby. So this is completely false. IVF babies develop exactly the natural way that conceived babies naturally. Once implantation occurs and the pregnancy progresses normally, the baby grows in the same way. However, because of IVF, pregnancies are often very precious, and couples who are wanting for many years, they consider that as a precious pregnancy. This sometimes lead to the higher rate of planned cesarean sections. Now let me ask another question. What do you think is more important, a normal delivery or a healthy mother and a healthy baby? So exactly, the ultimate goal is to ensure the safety of both mother and the child. There are situations in which we strongly recommend a cesarean section. These situations like fetal distress during the labor, placental conditions, failure of progress of labor, previous uterine surgeries, severe hypertension or uncontrolled diabetes, multiple pregnancies with complications. In such cases, performing a cesarean section is the safest option. So if you are pregnant with the IVF, who can do what we can do maximize your chances of delivering normally is eat a balanced diet, attend all your antenatal checkups, stay physically fit, take all the doctor's advice and all the medications regularly, maintain a positive mindset. And remember, every pregnancy is unique. This is not a single rule that applies for a single mother. So this is the common rule that suits for every mother. So IVF does not actually automatically mean a cesarean section. Many women can have the normal delivery after IVF depending on their individual medical condition. So if you have conceived through the IVF or you are planning treatment, do not worry unnecessarily. Discuss your options with your doctor and enjoy your pregnancy journey. Thank you for joining this Facebook live session. Have a wonderful day.